Alex Tenison is home.
I take walks each day.
He loves his video games, and he lives on his own, just a few blocks away from his dad, Larry.
Well, Alex is 35 years old now, and he's been diagnosed with autism since he was 3.
Alex is at his best when asked direct questions, and he's got a brilliant mind.
He's amazing. He can go forwards and backwards through leap years, doesn't matter. What day was July 4th, 1776?
Thursday.
Calendar head.
But lately, about every month, something goes wrong.
What are you hearing in your head?
I'm hearing Percy's whistle.
Yeah. He hears train whistles from when he's a kid. What do you think? What do you think when that happens?
That makes me scared.
Yeah.
When the incessant noises start, Alex flips a switch.
How did you get that knot up there?
Because.
You hit your head to try and make it stop?
Yes.
A recent episode lasted overnight, so Larry took Alex to the emergency room, hoping for a mental health hold and a psychiatric evaluation. A doctor told him that because Alex has a developmental disability, he doesn't make a good patient for mental health services.
I said, what difference does it make if somebody has DD? If they're having a mental crisis, they need treatment. It just shouldn't matter. What's the deal?
The Tenisons found out that people with intellectual and developmental disabilities face challenges accessing mental health care in Oregon. The medical system can silo one area from another, classifying symptoms as behavior. State Senator Sarah Gelser-Bluen says that's harmful, and she's seen it firsthand.
It's not appropriate for a person having a psychotic break to walk into an emergency room and be told, we don't do people with intellectual and developmental disabilities. And that happens. It's happened to a family member of mine. It's happened to many, many people.
Gelser-Bluen took her loved one to the ER for a mental health crisis evaluation.
I was told, as a person that's worked on this for years and a legislator, that there are 3 systems: a medical system, a mental health system, and a DD system. And my family member belonged in the DD system. Individuals with intellectual and developmental disabilities need to access all 3 systems because they all provide different things. And the fact that we don't do that in Oregon is nothing short of discrimination.
It is a problem that Oregon lawmakers recognize. In 2024, they passed Senate Bill 1557. The Oregon Health Authority then sent this memo to hospitals and mental health organizations, making it very clear that providers can't deny access to mental health assessment or treatment because someone has an intellectual or developmental disability. The memo says providers should assess clinician competence and confidence in this area, making sure they're prepared for the intersection between mental health and disabilities.
When providers say, or a CCO says, but we don't have anybody that's trained to do that. Okay, what are you doing to get people that are trained to do that?
The problem is, this new law and guidance only applies to people under the age of 21. A similar proposal for adults over 21 was folded into a bill to change civil commitment standards in Oregon, and that bill died in committee.
We absolutely have to address that.
Alex Tenison currently has some rescue medication that he can take.
I take a chill pill.
But in moments of crisis, he doesn't think to take the meds on his own. After many years of behavioral treatments and tests, Larry is convinced that the noises and outbursts are mental health related. He'd love medical providers to consider that perspective.
But I think until we start pushing back, I'm not sure the thing's going to change.
And Alex would too.
You want to get rid of those things, right?
Right.
Yeah. No more Percy's whistle, no more banging the head, right?
Right.
Yeah, that's what we're looking for.